Hi, everybody. I'm Diane Brady. I'm here with Eric Lefkofsky, who is, of course, Eric, you have so many different titles. You are the co-founder, former CEO of Groupon, founding partner Lightbank, and founder and CEO of Tempus. So welcome. Nice to see you.
Thank you. Thanks for having me.
So let's start with Tempus, because it's interesting. I've heard about it for many years, but it's one of those companies that is kind of out there, but we don't know a lot about. So give us a sense as to where you are now and what the value proposition is.
Yeah. So, and I think, Tempus has kept a relatively low profile, I think, certainly in part intentionally. I started the company about 7.5 years ago, about a year after my wife was diagnosed with breast cancer, perplexed at how little data was a part of her care. And at the time, I became fixated with this idea that there was all this background technology that had been created for other industries that could be applied to healthcare and certainly could be applied to cancer care and could help physicians make really high quality, data-driven decisions.
Yeah.
And at the time, about 7.5 years ago when we started Tempus, cancer patients were being sequenced really for the first time at scale.
Mm-hmm.
So there was all this new data that was showing up, all this new genomic sequencing data. And it was hard for physicians to interpret that data, in large part because it was new and it was just difficult to interpret. And so we started Tempus with the idea of bringing together the various technologies that would be needed to contextualize those sequencing results. And in doing so, we ended up building a platform that, unbeknownst to us at the time, allowed us to really contextualize any kind of diagnostic result. So by that, I mean, most of the major decisions that are made by physicians are made when some kind of diagnostic is ordered or laboratory test results. So if you think about it, if you've ever been, in a hospital treated or had somebody they're ordering blood tests or CAT scans or MRIs or EKGs or genomic tests, some kind of test. The test result comes back, and then a physician makes a decision. And the challenge is, as the data piles up, it becomes harder and harder to make decisions, especially in complex diseases like cancer. And so we set out to build technology that allowed us to basically take all the data we knew about that patient from their electronic healthcare record system. So who are they? What drugs are they taking? How are they responding? What's unique to that patient? And then take the output of the sequencing data and combine those two so we could actually contextualize the result around that patient. The idea being, if we're sequencing a patient, we don't want to recommend a drug that the patient's already taken in a prior line of therapy and failed. We don't want to recommend a clinical trial that they're not eligible for. We want the test to be smart. And so that was the impetus of starting Tempus.
Well, it's interesting because first of all, I imagine the advances in AI have been very critical to the advances in the business, but it's both a crowded space, but yet it's a space that has a high barrier to entry at the same time when you're talking about a highly regulated field like healthcare. How have the pain points been different when you look at some of the other companies you've built in the past? Has this been a longer progression to success? I know that you're now collaborating with Pfizer, so you're certainly in the big leagues.
Yeah. And we announced a partnership with Pfizer. We also, earlier in the year, announced a partnership with GSK, and
right.
Before that AstraZeneca. And then we work with, Tempus is fortunate that we work with almost 200 biotechs and most of the major pharma companies in oncology. But in terms of how building, look, anytime, I've been building technology companies for 25 years and they just happen to be in a bunch of different industries. And so I've had to learn a bunch of different industries, whether that's printing or transportation or media or local e-commerce. And, healthcare is certainly unique, both in terms of its regulatory aspects and the complexity of the subject matter. You're talking about medicine and treatments and things that are very complex. But I found it to be a super interesting space and one that I think is ripe for unbelievable disruption over the next decade or two as the benefits of technology and the benefits of artificial intelligence work their way into healthcare, we have the ability to have patients living dramatically longer and healthier lives. So it's been different to build Tempus versus things I've done in the past, but I think it's been far more rewarding because the output of everything we do is somebody who's sick that we're trying to provide a lifeline for, or get them on the right therapeutic path. And when you talk about cancer or depression, cardiovascular disease, the areas that we're in, these are just some of the sickest and most needy patients that there are. And so it's been super rewarding, and obviously the company has grown pretty dramatically over the past 7 years. And so it's been both rewarding from that aspect and from the quality of the work we do.
So before I do want to get to sort of you and I know people are fascinated by you as an entrepreneur, but I want to stay on Tempus for a second, because talk about what's happened with some of the advances in AI. I know that the excitements around some of the consumer applications, have those advances in the past several months made a difference to your business in terms of what you can do?
Yeah, Tempus, when I started Tempus, it really was built on the back of all of these background technologies that were built in other industries.
Yeah.
Low cost cloud computing, really built by companies like AWS and Azure at Microsoft and all these other folks, GCP at Google. All these people who had built this background low cost cloud computing for the internet. It takes advantage of that. It takes advantage of optical character recognition and natural language processing, and actually a derivative of that, which people are talking quite a lot about these days, is generative AI, or
right.
large language models that are derivative of natural language processing. And then it takes advantage of low-cost molecular profiling. If you look at some of the work that was done after we sequenced the first human genome, and companies like Illumina that have done unbelievable work. So when you add it all together and you think about low-cost cloud computing and the ability to generate high-quality molecular data at low cost, and all these new models that were largely built for social and mobile that allow you to kind of recognize images and do amazing things, those background technologies are what creates a landscape that's ripe for AI in healthcare. And up until, I think, the last 5-10 years, it was really impossible to think about how big data or machine learning or AI would permeate healthcare, because it was just too costly. It was just way too costly to think about structuring this enormous amount of healthcare data and making sense of it in any kind of way that would benefit patients. But now you can. And so it will likely be one of the ripest areas for innovation over the next decade.
I see that. I don't know if it's a new company. Is it Pathos AI? You wear a lot of different hats. Is that an outgrowth of Tempus, or what is that relative to what you're doing in the healthcare space?
Yeah, so when we started Tempus, we were focused exclusively on this notion of bringing the benefits of AI to diagnostics.
Right.
And in that journey, we obviously work with quite a large number of biotechs and pharma. And some companies like ours have made a decision to kind of get out of diagnostics and become drug companies. We very much consciously made the opposite decision. We didn't want to blur the lines of Tempus being both a diagnostic provider and a drug company. And so we made a decision to stay focused on diagnostics. That said, as the data was really building up, and today we have over 100 petabytes of data, and the database is growing at incredible rates, we were starting to see patterns in the data that somebody should try to take advantage of as it relates to developing therapeutics. And so we started a separate company, myself being one of the founders, and then a few others started a separate company, which Tempus is basically a small minority shareholder in, that has the ability to take advantage of some of those opportunities. And the main focus of Pathos today is using some of that data that it has access to help our pharma partners and biotech partners resurrect failed drugs, or figure out which drugs that they should be taking to market. And when they don't have enough capacity to do that, either because they have too many other things they're focused on or don't have the capital, then this entity that we created called Pathos is able to actually invest its own money in in taking forward some of those novel ideas.
When you think about how data is treated in this realm versus, say, Groupon, obviously, there's so much sensitivity around the data in the healthcare space. Just, right size for me how you think about it and what you think is changing as people become more aware of the value of the data as well. Not just people, but also, I'm sure, the partners you work with, the hospital systems, et cetera.
Yeah, I think I've said this historically. I think the regulations around healthcare data are actually, I think, an area that regulators can point to where they've done, I think, quite a good job of framing a construct that actually makes sense by forcing adherence to laws like HIPAA, forcing this idea of making sure that PHI or health information that's protected stays private, that it requires appropriate patient consent before it can go anywhere, that it needs to be de-identified before it can be used. And the laws that surround healthcare data and how it is managed are actually quite thoughtful, I think. Whereas if you look at the internet, it's not there, right?
Yeah.
So, and I'll say to people all the time, if I gave you a choice, I'll take your health, whatever's in your health record, okay? And I will run that on the NASDAQ, that big giant NASDAQ ticker in Times Square. I'll run your entire health record every day for the next 30 days, just be scrolling. Or I'll take every search you made in Google for the past year and run that. Or whatever Siri heard you say all day long, and I'll run that. Almost everyone says, you can have my health record.
Okay.
It's just not that exciting at the end of the day.
Right.
Especially in a world where some of the most historically taboo diseases are so common. There's 70 million people that are depressed. That's literally 1 out of every 5 people in this country. So,
yeah.
But what is, I think, not as well protected is a lot of the general information and searching and things we do on the internet or on our phone. And so I would suspect over time, some of the controls and protections we put in place in healthcare to protect that data and to protect patients will work its way into other non-healthcare sectors that I think could use those same kind of guardrails or those same kind of consents.
I know it's a different company, Eric, but do you feel you're a different type of leader in this company than you've been at Groupon, where I know you were CEO as well? I'm just curious, but the evolution you've started, you are the very definition of a serial entrepreneur. You often take on the CEO role. How does it feel different? Obviously very different industries. But anything that you think has changed?
Well, I'm 9 years older, so to some extent, I'm 9 years older, so I think it changes.
I don't know if that's good or bad. It could be both,
yeah,
right?
Yeah, I don't know. So it depends on the day. But I think in general, I'm relatively similar. I think the experience is vastly different. So, and I think what ends up happening as a business person, whether you're a leader or a manager or just somebody building or running a business, you do hopefully learn from every mistake you made historically. I think in general, a lot of business is about repeating everything that worked well and then kind of almost doing the opposite of everything that didn't work well, right? Or at least pivoting. And so at Groupon, we made a series of mistakes in building that company, which were foundational when I started Tempus to just not make those same mistakes. And in particular, one of those mistakes was the speed at which we grew and the speed at which we grew internationally. And also the amount of hype around that. And so at Tempus, we've taken the opposite approach, right? I just do the opposite. So at Tempus, we've been, for the last 7.5 years, almost exclusively focused on the US market. So we didn't go international crazy fast. The vast majority of our revenues and everything else are focused on the US market. We've been intentionally focused on not overhyping our story, even as we've had incredible success in terms of whatever the metrics are, whether business metrics or fundraising. We try to maintain a pretty low profile. And so I think you just have to learn from what didn't work and not repeat it.
One thing I've often found curious about your background is the fact that you went to law school. You were an entrepreneur prior to that. I'm just curious to what extent you felt that has been helpful to you as an investor, as an entrepreneur, as a CEO.
Well, I think, so I'm a 53, so I'm of the generation where it was very important to my parents that I go to graduate school. Back then, the kind of career path for most people was get a graduate degree and become a professional, become a lawyer, a doctor,
Right.
an engineer, an architect, whatever, right? Get some kind of graduate degree. So that was always, I think, important. And so for me, law school was like a continuation of college and just expanding the education. But I knew early on I didn't want to be a practicing lawyer. I had kind of been bitten by the entrepreneurial bug when I was a freshman in college, and kind of knew from that point on that I wanted to go into business. But I think it's a good foundational background. I do think many of these graduate schools either give you domain expertise that's valuable in life, or in the case of law school, also teach you how to be a critical thinker, how to see both sides of an argument, how to make both sides of an argument, how to articulate a story. And so these are all things that I think people use in business all the time.
Let me ask you just about the entrepreneurial environment. And again, acknowledging the fact that Tempus is 8+ years old, you're starting sort of new iterations, you're expanding the business, but you've lived through boom and bust cycles with the web and everything else. What do you think about the entrepreneurial environment right now, since you also look at this from an investment point of view?
Yeah, well, I think, okay, so in general, I think there's a lot there. I mean, obviously, these are turbulent times, and I think there's quite a degree of uncertainty in light of interest rates and the fallout of COVID and what it means for building, a high growth a company, whether that's tech or biotech or some other industry, and what that means for access to capital. And so I think, certainly in a low interest rate environment, which we had for roughly a decade, investors needed to chase growth other places because you couldn't just, buy a treasury or open up a depository account and get paid, or open up a CD. Mm-hmm. So you chased growth. And so high growth companies had like an accelerated success. And now with interest rates rising so rapidly, there's been an almost reversal of that. So, obviously the NASDAQ has done worse, for example, than the New York Stock Exchange. So I think if you're starting a company today and it's a company that needs a bunch of capital and is innately going to lose a bunch of money until it finds product market fit, it's certainly harder. But within that, I think there are sectors that are super exciting, and that I would suspect people will build all kinds of amazing companies. And health technology is certainly one of those, for all the reasons I mentioned earlier on. I mean, we're at a moment in time when we're going to keep people living longer and healthier lives, and we're going to bring technology to healthcare, and there will be very large businesses built in that space. And so I would suspect that those companies will do well. But it certainly is a unique moment, and I think as an entrepreneur, you have to be aware of the environment and make sure that you're thinking through how to prepare for the fact that what used to be easy in terms of raising capital or attracting investors or even attracting early clients may be much harder.
So let's go back to Tempus help us see around corners as to what's next. You've been in the oncology space. You're expanding, I believe, into cardiology, if I'm not mistaken. I mean, how big is the growth? And when we talk about precision medicine, I think people have a certain mindset around that, a certain impression as to what that means, especially in, when you talk about cancer and such. Can you give us some sense, like, say, 3 years from today, how you hope to look different?
Well, I think, so the good news is Tempus is already, getting to some real scale, and
right.
We're almost 2,500 people. It's a real business, so it's at real size. So 3 years from now, you hope that the business is just, our core growth rate has been, quite extreme in terms of overall growth rate. And so, I mean, that can't be sustained. You can't grow at 100% a year forever, but we do hope to grow at a significantly higher growth rate than most companies in our space, or most companies that are even in the reason. So you hope that that continues, and you hope that the foundation what you're building gets bigger. We're fortunate in that, first of all, technology hasn't permeated diagnostics in a big way. So we're a first mover, or at least a early mover in a very big space. And when you talk about bringing technology to healthcare, this is roughly the healthcare space in the United States is almost $3.5 trillion, and by many accounts, the waste is roughly a third.
Yeah.
So you're talking well north of $1 trillion of waste in the U.S. healthcare system alone. Globally, it's probably 3 trillion. And so any company that brings efficiency to that space can get quite large just by virtue of how big the numbers are. So, I don't know if Tempus is going to be the winner in that space long term, if we're going to become the Amazon or Google of this space. But it's certainly, there's an enormous amount of room in front of us to grow by virtue of how large the space is, and how well people are taking to our products, and the rate of adoption that's currently occurring. So it does feel like we've got some good running room.
What about Groupon? Anything you'd want? I know you're a director now. You're not in the chairman role. Is that a business model that you see sort of having continued growth, or anything you'd say there? Because we're certainly, it's part of our consciousness. Many of us still use it. I know it's struggled, certainly from a shareholder, et cetera, point of view. What can you tell us about some of the how you're thinking about that property?
Yeah, so I'm on the board of Groupon, but no longer a chairman, and no longer involved day to day, and haven't worked at the company in almost 8 years.
Right.
So I think there's been quite a bit of work done by other people trying to figure out how to make that business successful long term. And I think it's been challenging. Groupon as a business model, and this speaks to local commerce in the aggregate, has had a tough run post-COVID for a whole bunch of reasons. First of all, during COVID, people didn't want to do things locally. They didn't think about spas, for example. There was a time when no one wanted to go to a spa or get their hair done, because you were afraid that you were too close to people. And then once that subsided, there was a labor shortage. And so if you were in the business of selling coupons at those places, it was tricky because no one had any labor. And then once that subsided, we had massive inflation. And so the last thing people want to do is discount their prices when they're actually raising their prices.
Yeah.
So I think there's a lot of businesses like Groupon that have kind of suffered from those macro dynamics that are tricky. And I would like to think, as the markets normalize, if that team can be successful, they'll find their footing. But the good news is there's other folks that are kind of working on that, and I'll continue to be supportive from the sideline. But Tempus is just, I can only do one thing well at a time, and for the last 7+ years, it's just been Tempus.
Great. And is there anything else on your radar you'd put on ours, Eric? Especially since you are somebody who does like to start businesses, you have a history of that. Is this where you plan to stay for quite a while, this neighborhood of healthcare?
Yeah, I can't imagine, first of all, I think I'll be at Tempus for obviously quite some time, and I can't imagine getting out of healthcare. It feels to me like this is where I belong, and so it kind of almost feels like I found my home after a long time searching. So that's super exciting. I think the thing that should be on everyone's radar, which I think is on everyone's radar, is we've been talking about how AI is going to permeate diagnostics and healthcare for the last 7.5 years. I don't think people could really quantify what that means. What is AI?
Yeah.
And I think what's happened with ChatGPT is that people are all of a sudden like, oh, there it is. Like, I can now touch it and interact with it, and it's amazing in its capability. And I think we're about to enter this period of the next several years where you're going to see many businesses that are really transformed or kind of hyper accelerated by virtue of these large language models and the ability to bring generative AI to their practice and what it can do. And if you think about healthcare, for example, there will come a day in the very near term where physicians can interact with technology companies like Tempus and have an infinite number of conversations as if they were literally talking to the foremost experts in the world at one time. Like imagine if you as a patient or a physician could get the 50 best cardiologists in the world all on the phone with you for an hour or two, for you to ask very specific questions about your very specific cardiac patient who's having very specific hypertrophic cardiomyopathy or aortic stenosis or atrial fibrillation. That's what's about to happen. And what that will unlock, I think, in terms of this migration of taking good doctors and making them great doctors and great doctors and making them super doctors is going to be really profound.
Great. I agree. It's an area of great excitement, and it's great to get your insights on it. So thanks for joining us, Eric.
Thank you. Thank you.